Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support for today's episode comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Learn.Physio. Health professionals, are you staying ahead of the game? Learn.Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources, all backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at Learn.Physio. Morning, mate. Happy Monday.
G'day, Mick. How are you?
I'm good. Got some big news for everyone today, mate. Bit good and bad.
Yeah, what's that?
Bit sad, but, mate, it's our last episode of season 2.
Well, it is good and bad. It's been
good and
it's
bad.
been a great season. I think we're up to, this is episode 24 in this season. I think we did about a similar number in season 1. So we nearly
of all the seasons we've done so far, this has been the favourite. Of all my babies, this is the favourite. No, it's been great. It's been a nice little change of pace. I've really enjoyed the expert interviews and their insights. That's been for me probably a really enjoyable part. Connecting with wonderful, very clever human beings all around the world, bringing it all together with our 2 cents worth. It's been a really, really enjoyable series. I've enjoyed it a lot.
Yeah, and that's what people have also been telling me is they enjoy the interaction between you and me, but also bringing in the experts as well because
people like our banter.
Yeah.
They like me, my dad jokes and wild anecdotes.
Are you just getting that from your family?
Yeah, they do. No, my kids hate my dad jokes. They told me to shut up this morning because I was full of it. But anyway, it's been good.
Yeah.
Well, I enjoy because we don't get to see each other much face to face. You know, me being in Townsville, you being in Melbourne these days, so I get to at least have my catch up with Randall every fortnight. So it's been enjoyable.
Yeah, no, likewise. We are going to take a break for, we don't know how long actually. It'll be some weeks. It's not going to be 6 months or a year or anything. It'll be some weeks.
We'll be back. We'll be absolutely back.
And we will look to introduce, we'll do much of the same, by the way. We're going to, when you're on a good thing, you stick to it. So we're not going to do much different, but we will bring in another element, we think, which we hope people enjoy as well. So yeah, season 3, here we come. But you've always got theories on seasons. So do you think we're going to get better for season 3?
Of course, you always get better with every subsequent season.
How are we going to get better?
I think we're going to get. We might. It's a big, bold prediction, but maybe if we get a sponsor outside of our own businesses, maybe someone else might want to come on.
Right.
Yeah, I don't know, Nike. I don't know, McDonald's, Coca-Cola. The big dogs.
Yeah.
They're completely, especially Coca-Cola and McDonald's, are completely anti-exercise matters. But who knows what could happen? Well, I'm open to suggestions. So if anyone's a marketing genius at any of these companies that wants to support a little old podcast from you and I'd be open to discussion.
We'll see what comes our way, Mick. Don't hold your breath.
No. Free pair of shoes or something like that. Who knows? Anyway, I'll be happy with anything. Coffee, even a coffee sponsor, because these bloody coffee beans I bring to the table every second Monday, it costing me an arm and a leg.
Yeah. Well, in the break, if people do have any suggestions on what they'd like to hear from us, please send them through. We will definitely read it and we'll probably do another round of 23, 24 episodes in season 3. Plenty of scope to do a lot of work there. But Mick, what are we talking about today?
Today's an episode pretty close to my heart. I've been publicly speaking about mental health lately from a personal experience of my own, and I felt like today was probably a good way to, because we've sort of not danced around it, but we've sort of talked about the benefits of exercise in lots of different ways. But I definitely wanted to hone in particularly with exercise as a really viable, I guess, treatment option for people with depression. So it meant like, the topic, is exercise and mental health, but probably the strongest evidence that is available to digest and talk about is on people with diagnosed depression as a population. There are some papers that sort of fringe on anxiety as well, and there's lots of different mental health problems that people face, but this one a little bit more on depression. So that's today's topic, is because we sort of there's messaging along, if we kind of take a back, so there's often lots of positive commentary that exercise is good for mental health as a whole, but what does that actually mean? Like, is it, and that's what I want to talk about today, is it going for a walk, is it joining a gym, is it getting into like a sporting club, or is it going to the gym lifting weights, or is it doing yoga, is it, and I guess exercise is such like a big broad umbrella term that I just wanted to really try and sort of pinpoint what aspects of exercise are good, and even importantly what populations tend to do well, and if there are some guidelines about how long and how frequent and time and all those kind of things. So probably get into a little bit of the weeds about what exercise benefits people with depression. But it gives some really good guidelines there. And I found a really interesting paper about exercise as a preventative tool before people develop depression. And we'll wrap it up with, kind of like what we still don't know. I think we've kind of got, general, pretty clear sort of recommendations that exercise is helpful, but there's still a lot of unknowns, and, so that's what we're going to go through today. So a bit of a heavier topic, and apologies if this, for some people, might maybe sort of uncover a few wounds. And but so it's always an important part. Mental health is such an important part of well-being and health, and what makes us, people. So, but I think it's a really important topic to tackle. So we'll dive on into it.
I think for me, this episode is a really key one for us as a podcast, because you and I, being health professionals, like we straddle the exercise being for both health and also for performance. And you can definitely kind of go down a rabbit hole on a podcast like this, where all it is about performance, about running faster, lifting bigger weights and all this kind of stuff. But the cliche is, and it's been used a lot in the last 15, 20 years, is exercise is medicine. And whether it's your cardiovascular profile, whether it's bone health, joint health, whether it's muscle health, we know that exercise is beneficial for that. And mental health, I think, is a crucial one as well, because it's becoming more prevalent in young people. It's something where I think that for a lot of people feel that if you are struggling with depression and mental health issues, either counselling or medication are the two things to do. Without giving the game away, I've read into this a little bit myself, and exercise can play a very, very powerful role, either as singular or adjunct to the other therapies. But I'm glad you're tackling it. And I think it's a nice way to round out the season. Yeah,
agree. And I think that would be, obviously a few important sort of, I guess, nuances there in that. But I think it's important. And I just love how, like, people, go back 20 years, mental health was definitely a thing not many people openly talked about. And I think there's definitely a generational shift there that's been really positive. And for us to kind of, use our platform again, and what we sort of really promote is just general good, health and performance and exercise and well-being. And I think, if we can also talk about it too, and try and reduce some of the stigma associated to our audiences too, I think is just, such an important thing to do. So, it's I've really enjoyed that shift, because I think there'd be many people that are still trying to come out of the woodwork from years gone by. I think the younger gen, the Gen Xers and millennials are much more openly able to discuss it, but people of our era and older are still probably not great about talking about it. Any opportunity to shine a light on it, I'm here for it.
Agreed. All right. Well, you got some studies to talk about?
Yeah. So the first one's kind of a broad look at it, and addressing adults as a whole. So this paper was a systematic review by Notel and colleagues in 2024, titled Effect of Exercise for Depression, a Systematic Review and Network Analysis, published in the BMJ. And it aimed to identify the optimal dose and modality, the optimal modality of exercise for treating depression, if there is an optimal modality, compared to psychotherapy, antidepressants, and control conditions. So a pretty bold study and breakdown of, comparing exercise to already known, established, effective treatment options plus controls. 218 unique studies were identified with over 14,000 participants. So, pretty
big study. Yeah.
Big study. Exercise modalities looked at within the study were walking, yoga, strength training, aerobic exercise, tai chi, dance, cycling, exercise plus antidepressants, and exercise plus psychotherapy. So a lot of stuff brought into it, and they were compared against active controls who were undergoing a psychotherapy treatment with a placebo tablet or stretching or educational controls. So nothing really active in terms of the active form of care, a weightless control, or comparing the exercise against known, already established treatment options such as antidepressant medication and cognitive behavioural therapies. The main primary outcome here was change in depressive symptoms using already validated measures. Overriding results here were really in favour of exercise. So compared to active controls, the review found that yoga, walking or jogging, yoga, strength training, and a mix of aerobic exercise plus also tai chi, there were the moderate effects of active exercise compared to our comparator group. So it's really, really important and overall feature of exercise is a really known and established treatment option from the available evidence. There was a large effect for dance, but it was a small study. So that sort of estimate has sort of just been encouraged to sort of temper the enthusiasm. So compared to already established medications, the exercise is a really valid form of treatment options, either as a standalone, but probably steering towards being a very valuable complementary treatment option with the established medication, antidepressant medication, or cognitive behavioural therapies and exercise. So we can really be comfortable knowing that we should be also encouraging exercise as part of the regime in helping people manage their depressive symptoms. So yeah, pretty good. In terms of exercise, there was really no huge standout. There was a list obviously there that I went through before. They were all just equally as effective as each other. And like anything, I think when it comes down to it, what you enjoy doing really matters the most. If you like to walk, if you like to jog, if you like tai chi, if you like aerobic exercise, whatever it is, if something that just gives you a really good boost of, endorphins, big serotonin hit, to complement the exercise, it really matters. And that consistency to train and exercise to give you that long-lasting treatment effect. Going for one walk is not necessarily going to, shift your kind of mood immediately for the long run. Yes, it might make you feel better on the day, but that one walk needs to be backed up over and over and over again to a certain level. So it's a really nice study to kick off with, and that's adults over the age of 18 up to 60. So it's a really broad group of participants included in this trial.
Did they discuss at all dosages in that you had to do a minimum amount of exercise each week for it to be essentially a minimum effective dose?
Not in particular in this one, but there is a couple of papers I'll come back to that will. They did talk about intensity matters. So rather than the 30 minutes per 60 minutes or frequency per week, but the intensity did lean more to a vigorous form of exercise, producing stronger effects. But even lighter activities did still help. So some exercise is better than none, but where appropriate, trying to get that little bit of a lift in intensity can yield slightly better results. And I think the big strong conclusions here is, exercise is a nice complementary form of treatment. And I think this is where, even though it is compared to comparative established medication and cognitive behavioural therapies, it did perform very well as a standalone treatment. But like anything, I think exercise is going to take time to work. And having, been on antidepressant medication myself, it took it took a bit of time for those medications to kick in, probably about a week or so. For some people, the effects of exercise are going to take, and the positive effects of exercise are going to take longer than a week to really sink in. So for me, it's kind of, I'm just a bit cautious having some personal experience here, just to sort of say, if we're going to sort of make some bold claims that you don't need to take antidepressant medication, or, don't worry about cognitive behavioural therapy, you can fix yourself with exercise. I think we've got to be really careful with that statement. And I probably would be a bit cautious in saying that. Obviously with any kind of mental health disorder, it needs to be sort of also managed appropriately through your GP and psychologist, but also too, exercise will play an important part of that package. And that's where I think this is a really strong paper and systematic review to say, it's a really good modality to help with the other established forms of treatment.
What do you feel that, we're in Australia obviously, do you feel that the GPs and also the psychologists that are out there promote exercise enough for these patient groups?
Yeah.
I know it's a subjective question, but
I don't know. Like I've got a few GP mates, and obviously I've got a good relationship with my GP. I think it's there, but the prescription or the I guess the supervision or the motivation, and I don't know. It's like if it's just like you need to exercise and that's kind of it. Maybe like they are promoting it, but in a very non-structured, non-formalised way. Like they don't sit down and say, okay, here's your 150 minutes per week. I haven't came across that experience myself, and I'm not sure. Like I may be sort of saying that. There'd be probably some great GPs out there that do take exercise really, really seriously. I'm sure the sports and exercise physicians who have, done that extra training, who do focus purely on sports and exercise as their treatment option, compared to a GP who has to manage so many different ailments around the body, where exercise sits in terms of the person's, treatment option. I don't know, but my gut feel would say that exercise is probably promoted, but not to the point where it's probably very specific to the person sitting in front of them. I think that would be my gut feel. But
my gut feel would be exactly the same, and that is that if you think about the other two common therapies, being medication and also psychology, is that there'll be dosages, like we'll say, all right, here's your dosage of your antidepressants, or, let's go and we'll get you a treatment care plan for, 6 or 12 sessions or whatever with a psychologist, and then review. When it comes to exercise, I think that most doctors will say, exercise is great. You go and exercise, do as much as you can. But I think that, and I think this is an opportunity also. We've got a lot of exercise and health professionals that listen to this podcast as well, is to help people with this and to go to the GPs and say, if you do have someone that you are recommending to have an exercise program for depressive symptoms, I can help structure that. I don't necessarily need to see them once a week, but I could review once a month or once every 3 months and help them work out what they want to do, what's safe, what's good for their body. Because as you and I know, if people go out and they start exercising and it's a bad experience, i.e. they get an injury, or they just start getting sore, or they feel like it's a chore and they're not enjoying it, they'll abandon it. So I think that if they can get some professional help and some guidance with that, I think that could be really powerful also.
Yeah, I agree. The last thing you want to do is, say to someone, go off blindly and exercise, and all of a sudden now, like you said, get an injury, or they all of a sudden now can't move, can't exercise. And the thing that's going to sort of give them another bit of a boost, or at least potentially improve their mood by a few percentage points, and help complement the psychotherapy and the antidepressant medication. Like it's another adjunct that's just been sort of taken away because of poor exercise planning or poor exercise prescription. So exercise physiologists obviously are perfect in this sort of realm. Strength and conditioning coaches, these are like the perfect people to sort of making sure we sort of fill that void. Physiotherapists obviously are an important part in the process as well. Probably our mindset's still about trying to more so help people who are injured, but there'll be appropriate times where someone's referred to physiotherapy for this management. There's a lot of really good allied health professionals that are perfectly trained for this type of
EPs EPs should be number one.
Yep, absolutely. Paper 2 was just taking another look specifically at college students. So this was a paper by Zhang and colleagues in 2024 in the effect of physical exercise on depression among college students, systematic review and meta-analysis published in the Peer Journal. So it's a younger age group, but also too looking at a group of people who are really, kind of also too have high rates of depressive and mental health disorders. 8 articles and about 500 participants. We had a group of about 260 in the exercise groups that were broken down and compared to a group in about 230. So a nice sort of bunch of comparisons there, but not as strong or as big as the previous adult population that I mentioned before. The rough age of the college students as a whole sort of sat between 18 and 22-year-olds. So that sort of gives us a really good idea here. So importantly, this is college students, and unlike the first paper where they had clinical diagnosed conditions, this is college students with depressive symptoms, not actual diagnoses. So that's an important sort of distinction here. Nevertheless, the included exercise modalities were high intensity yoga, high intensity interval training, Pilates, therapeutic exercises, mindfulness exercise, Tai Chi, yoga, lots of different types of exercise, heaps and heaps of different things. And the length of the interventions range from weeks 4, so about 4 weeks of intervention, up to 12 weeks of interventions, with session durations starting from as little as 10 minutes a session out to 90 minutes, and frequency ranging from 1 to 5. So a huge, difference there between all those things. And they were put up against, and the outcomes looked at were some validated outcome measures. The main results here was that there was a significant effect of exercise on depressive symptoms that favoured outcomes as opposed to static control treatment options. Importantly, this one gave us some parameters, unlike the last review where it sort of gave us the overall message that exercise was good. This, compared to other treatment options, this was good, but it didn't give us any dosages. This gave us some really nice dosages to help with depressive symptoms in college people. So 12 weeks or longer was better than less. 30 to 60 minutes per session was better than less, and those that performed at least 3 times a week. So they were, some really nice frameworks for people, college people with depressive symptoms. If we can get that type of dosage, we're going to have a really good, strong effect on their symptoms associated with, depression, anxiety, and mental health. So another nice, clean paper looking at a different population.
An important group because, as we know, this younger generation who have grown up now with social media and computers and screens have got more mental health issues than what the older generations have had. So we need the antidote. We need the medicine. And one thing I think's really, really cool, and I don't know whether this is by design or default, is that we've seen the rise in run clubs, with young people and how they're not going to go out and party on alcohol, till all hours in the morning, but they're getting up at 5 o'clock instead and going running with 200 other people. I think that's awesome. So I wonder, this is I think the study you said was published in 24. So that was probably, a lot of research was up till 22 or 23 at the most recent. So I just wonder, hopefully, whether that cohort's starting to kind of change and adapt as a consequence to make sure they're looking after themselves as well.
Yeah, well, I think that, as I said before, there's this generation that are just so mindful of their mental health, and they're happy to discuss it and really open with discussing it more so than previous generations. And I think I might have mentioned before a few weeks ago, I was down at where my soccer does his training. My son does his soccer training on a Thursday afternoon. There was a group of 200, probably 18 to 25-year-olds that just came in and just went for a K run, and the guy on the microphone saying we're going to run here, and then afterwards we're going to go for a beer. But as they run off, they're obviously different levels of running fitness, and you've got groups, and so it's got such a great community feel. So you get the exercise, you get the community, you get the kind of bonding there, and obviously afterwards you get to sit and have a laugh and enjoy the beer on the strand in the sun. Such a great positive way to sort of spend an afternoon. You bank a few of those, good sessions up each week. It's gonna be good. But I think that's where, if I was thinking about this last night as I was doing preparation, I think there's this assumption that people that look fit and healthy and do fit and healthy things are immune to this kind of, they're immune to depression or they're immune to anxieties and stresses. there's such a big disconnect there. It's not.
Yeah.
And that's where we need to have the complementary psychotherapy, have your regular check-ins with GPs, because there's a lot of people that have, obviously seen a lot of, have experienced bad things that really sort of gives them, mental health problems. So you can't just fix it with exercise. It's got to be part of a big package. But it's clear here from these studies that exercise helps quite a lot. And I think certainly when it came to that first study, we said, something's better than nothing. It rings true here for college athletes and college people as well. Moving on to children and adolescents too, another really important group of the population, and certainly an area where, like kids that are, going through some hardships and some problems in mental health, but, teenagers who are, really struggling to navigate the world, going through puberty and adolescence and, bullying and, problems online and that kind of stuff. Like, it's such a pivotal part of their life that, if we have, problems here, they can certainly manifest and play out, as years go on. So this was a really nice, strong study, once again, looking at the effects of exercise interventions on depression in children and adolescents. A systematic review led by Lee and colleagues in 2023, published in the BMC Public Health Journal. This was a review that included 35 randomised control trials with 5,400 participants with a mean age of 13 years of age. And it included participants across many countries as well, including US, Australia, UK, China and Iran. And basically the eligibility of these kids was that they had to be age under 18 and with an exact diagnosis, medical diagnosis. So unlike the college people, they had depressive symptoms and nothing formally diagnosed. This was a really true medically diagnosed condition of depression. The interventions looked at aerobic exercise, resistance training, group training, or circuit type training. It also included things like martial arts, yoga, and aerobics classes. Once again, this study also tried to look at dosages, optimal dosages. So it's a nice, neat study. The main findings of this paper was that it had strong evidence to support that exercise significantly improves depressive symptoms in children, with aerobic exercise having the highest probability of being the best, group training coming in at second, resistance training coming in third, and mixed form of other exercises coming in at fourth. So really, really strong paper with a nice framework here, once again, of 12 weeks minimum intervention, with 40 to 50 minutes per session seeming to be the really nice time frame for these younger kids, and 3 sessions a week once again. So we're probably seeing a nice sort of, nice structure of what is an optimal dosage of exercise per week to have these really significant effects on mental health.
Any distinguishment between males and females, the girls and the boys there? Because I know that you and I have discussed this from a musculoskeletal point of view, maybe not on this podcast, but we've discussed it about knees and stuff, that girls particularly, once they kind of hit 14, 15, 16, there's a significant drop-off in sport. A lot of them will just abandon it, and then they'll kind of resurge themselves kind of like in the early to mid-20s when they rediscover it. But I just wonder whether there's a difference between the sexes kind of in how important that is, particularly for the girls, that, are they more vulnerable because they drop off more, for instance, in their mid-teen years?
If it was reported, I missed it. So I'd have to go back and clear that up. But I don't have that in front of me, mate. I'm sorry, I can't answer that one. I do find it's a great point. It's a true point. And I do also find, having sort of, worked a bit with teens at the moment, and also too, even like groups who are a little bit younger. I think the challenge with this age group is probably getting them into structured things, like, to do like a one-on-one session with a personal trainer, or I think that's probably the biggest challenge we would see in this group. I think exercise for an adolescent group, I don't know, like my experience working with, one-on-one with these kids, they're probably kind of at that awkward stage where they just vast majority of kids don't particularly want to do it.
Yep.
Unless they're already highly intrinsically motivated and, are looking to get that little bit better on the sporting field, and they're happy to sort of, go through like, learning how to squat or how to deadlift or having a program that's going to make them a bit faster. There's probably a couple of kids I've worked with in that age group that are at that kind of end, and they've already had like a big, strong sporting history. But a lot of the teenage kids that get brought in by mum and dad who have got, some kind of, musculoskeletal problem, there's just this kind of the body language, the way they sort of interact with me and mum and dad, like exercise, to say, go off and do like 40, and assuming, let's just sort of say these kids, have got, and I don't know if they do or not, but let's just assume they've got depression. I just would struggle to see this particular kid go off and do like a one-on-one exercise session, 3 times a week. And I think that would be the challenge for exercise professionals and GPs and psychotherapists and parents and I think that would be the greatest challenge. And to find something that's engaging and fun and motivating, almost like gamifying the weekly dose of exercise, I think would probably be one of those things. But like anything, you just would have to find what makes these kids tick and really make it enjoyable. And unlike adults and college students who've probably got a little bit more of brain development and have got an understanding that, this is going to be good for me, like it's going to make me a happier person, it's going to be good for my general health and well-being, in the years to come. I think in that 13 to 15-year-old age group, it's just really tough. They're just so internalised and almost like so egocentric that they probably just don't have that foresight yet to know that what they're doing right now is going to be good for them in years to come. Yeah, challenging age group.
Yeah, and in a lot of respects, it's also just not emphasised or included kind of like in their school either. I know that with my girls, having gone through school, once they got to year 10, PE was dropped off, and then there's no such thing as compulsory attendance at the swim carnivals and the aths carnivals and whatever. It's all up to you whether you want to go or not. So essentially, like physical activity is dropped from the curriculum. And then overlaying that is that, they're busy. They've got study and there's an emphasis on academic results and whatever and not physical well-being. So I know this is being discussed at different levels of the education department, but I feel that, if you're not getting it at school, for the people who've got kids at school, you really have to try and push to kind of make sure it's done outside of school on your own terms.
Yeah. Yeah, tough group. All right, moving on to resistance training. So obviously, we're big proponents of strength hypertrophy. Love our resistance training. So I just wanted to know, is there, because a lot when we talk about exercise, I think there's this kind of vision that, exercise has to be cardiovascular based, but bike, swim, walk, run, some kind of blood pumping kind of exercise. But there's some evidence to say resistance training is a really valuable tool in the management of depression as well. So this was a paper led by Gordon and colleagues. It's published in 2018, and the Association of Efficacy of Resistance Exercise Training with Depressive Symptoms, a meta-analysis and regression of randomized clinical trials, published in JAMA Psychiatry. So this was a review that included 33 randomized control trials with 1,800 total participants, with about 900 in the resistance training group and about 900 in the non-active control group. Mean age of participants was about 52 across all the studies, and 67 participants of this group were female. So they looked at, once again, tried to get an idea of optimal dosage. So they did include resistance exercise training studies that were compared against a non-active control group in people with established depression, and the intervention duration ranged from 6 to 52 weeks, 2 to 7 days per week. They did look at low to moderate intensity resistance training sessions. They did look at interventions that were supervised or partially supervised, and they also looked at adherence as well. With the outcome measures being, the primary outcome measure being the change in depressive symptoms over a period of time. Now, the main headline result here is that resistance training, once again, resistance training was significantly associated with a reduction in depressive symptoms with a moderate overall size effect. So, we've talked about previously in these studies, we've got small, moderate, and large effects of a lot of these interventions. So we had a moderate size effect. And that kind of applied to the authors concluding that it had a number needed to treat of 4, meaning that for every 4 people who completed resistance training, 1 person would be expected to benefit who would not have improved under the control conditions. That's a pretty good result.
It is.
Yeah, and so the key findings here that the antidepressant effect of resistance training was seen in this population regardless of age, sex, health status, program duration, session intensity, frequency, or total prescribed volume of resistance training. So really, really broad benefit there. And it wasn't, but the benefit wasn't seen and dependent on a measurable strength gain, meaning that just because you are getting stronger doesn't make you feel better about yourself too. And that's often the implication there is that, you're getting stronger, you're getting bigger muscles, you're looking, better in the mirror, or you're feeling, a bit more bigger and bolder. Like it doesn't, the resistance training's, the benefits are byproduct of you actually going there and being active in the gym. So this was cool. This was another, big win for resistance training. And obviously exercise as a whole. So it probably didn't, like anything, if resistance training is going to be beneficial, we have to apply what we want to achieve. So, if we probably go back to our previous discussions about if we want to get our muscles bigger, we'd go to our hypertrophy, resistance training methods. You have 2 to 3 sessions a week, anywhere between, 30 to, 70% 1RM. That's about that volume we talked about in the last episode. Yep. So I'll probably go back and have a listen of that episode if you want to have a bit of a deep dive into the specifics of resistance training for hypertrophy. But yeah, if we just sort of use the umbrella term resistance training, very, very positive effect on depressive symptoms and people with depression.
Yeah, the thing that's got me thinking is that, clearly there's benefits in doing resistance training. I also, there's benefits in doing aerobic training. We saw that in the kids study. It's like, what is the underlying physiology and mechanism that's improving mental health? Like, is it actually the doing bit, that you've got a purpose and that you're actually involved in something and having something to do other than just worrying about what you're thinking? Or is there, is the change in blood chemistry and muscle strength and the chemicals that are going to your brain as well, is that what's the endorphin release that you get? Are they the things that are improving things? I don't think that the answer is out there, but be interested to know if it was what it was.
Yeah. So I don't know, like with the the physiological effects of exercise or being out. There's probably not clear yet, but my own personal experience with it is that when I had just started, probably going through before I started getting treatment, going to the doctors, I just remember going to the gym and just starting to lift weights again. And I remember going for the first time where, like exercise is really good for me, because when I went to, my head was full of noise, and I'd go to the gym, lift some weights. When I was about to pick up a heavy weight, there was nothing in my mind other than pick this heavy weight up from the floor. And it was a very different sensation for me going out for a walk at that time. And this is like pre-medication, pre-seeing psych. And that's what the distinction for me. And I think there's probably something in that, because when you are obviously in your head quite a bit and you don't know how to sort of get through some of those ruminating thoughts, or, try and sort of problem solve, some of the things without the help of professional qualified, psych. That's where I found the benefits of going to the gym, because it's just like a super heavyweight, whack a 50, 60, 70 kilo weight on my back. It was like, all right, I don't want to get crushed by this bar. Yeah. I'm going to lock in. And there was nothing going on in my mind other than just push, stand up, down, stand up, down. And for that whole session, doing squats and deadlifts, my mind was clear. But then obviously, when I left the gym, then all these kind of, problems, started, simmering up again. Compare that to when I went for a walk. Like, I always felt good after a walk, but sometimes if I was, really stuck in my head, I'd ruminate on things when I was out for a walk. So I think each person is going to have different kind of responses based on what they need and what's going on with them and that kind of stuff. But for me, that experience of going to the gym and lifting heavy weights was just almost like that period of mindfulness. It was just that kind of break in my brain that I needed. So yeah, I think there's obviously the physiological response there, but also too, for some people, it's going to the gym, having a lift with their best mate, or, the effects of lifting and, some of the muscle growth they see, or that physical feeling of actually being stronger now. There's going to be like a multitude of things there that helps people. So yeah, it's one of those great unknowns. We probably don't know exactly why yet, but we know it helps. So yeah, resistance training for the win.
It's a really good point, that mindfulness aspect of exercise and sport. I get the same with when I ski. So when I go snow skiing, I'm in the moment. I'm just worrying about, getting around that boulder, this rock, that mogul, whatever it might be. Being in nature, I completely switch off from the rest of my life. And even though, yes, you do come back to whatever, like life issues are going on for you, I do think that reprieve is very medicinal. So maybe that's a component of what's happening here.
Yeah, agree. All right, moving on to exercise as a potential preventative measure. So this was a really interesting sort of take on what we've seen already. So this was led by Pierce and colleagues in 2022, and the paper was titled "The Association Between Physical Activity and Risk of Depression: Systematic Review and Meta-Analysis," also published in the JAMA, JAMA Psychiatry. So this was a meta-analysis including 16 prospective cohort studies with nearly 200,000 participants. Massive paper and population looked at. And I think a whole lot of inclusion criteria, including those aged over 18, and a follow-up of at least 3 years.
Wow, okay.
So this wasn't people, just importantly, just to distinguish everything we've talked about. This is people starting from a baseline study and tracking over time to see, do they develop any kind of medically diagnosed depression? So they looked at physical activity and different levels of exposure of physical activity in a prospective way. So they looked at exercise in terms of METs, so the metabolic equivalent, and they tried to differentiate it between exercise, the recommended guidelines of exercise, and then above that. And then they looked at outcome measures over time. And obviously the main outcome measure they were looking to identify was a diagnosed case of depression in the follow-up period over time, either minor or major. The main results of this study were that compared with adults doing no physical activity, those that were doing half the recommended volume of work. Now, the recommended volume of work was about 2.5 hours of brisk walking. Half of that, even half of the recommended dose, gives us an 18% lower risk. Those that were doing the recommended dose, which is about 2.5 hours of brisk walking per week, had a 25% lower risk. And those that were doing double that again, the risk sort of started to plateau out, sort of about 28% lower risk. So there's definitely a sharp improvement. So if you're only doing half of the recommended exercise, you'll get a benefit. So compared to no exercise, some is better than none. If we're meeting our recommended guidelines, we'll have a 25% lower risk. But that little jump up of beyond what's recommended, we're not seeing a huge, massive linear result here. So there's definitely some, some recommendations here that just meeting guidelines is going to be helpful in reducing the risk of a future depressive episode. Yeah, pretty cool study.
It all goes back, I think, to, what I said at the start is dosage, and getting and advising people on what the correct dosage is. And I know this is on prevention, not treatment, but I think the interesting thing for me to take away from these 4 or 5 papers that you've discussed in this podcast is that you don't need that much. It's not that if people either have depression or want to avoid it, need to go and start doing ultra marathons or start competing in Mr. Olympia. Like even just getting out for 2 or 3 hours a week, some brisk walking is usually enough to kind of help you here. So I think that's really good. Like that's cool. You don't need to be an Olympic athlete to benefit from exercise and your mental health.
Yep. No, it's true. We've got those guidelines that, obviously we've got to be careful about generalising from one study to the next, but, that's why we've got, the World Health Organization guidelines. And we've now got, as you talked about before, a couple of episodes ago, the American College of Sports Medicine guidelines for resistance training. With those two kind of big meaty guidelines there, we can take some of those recommendations that have been looked at in terms of lots of other different, health and lifestyle related problems and disorders. We're applying some of that contextually here. But even if we look at the college population and the kids, we saw there from those two sort of studies there that anywhere between 30 to 60 minutes, 3 times a week was key. But the key thing here is that the duration of the intervention seemed to be the thing that mattered the most from what because the times can change and the frequency can change, but it's that length of time here that's going to give us our biggest bang for buck, and those interventions that last at least 12 weeks. And that makes sense. Like if we want to make a true positive change within ourselves, our mental health, to help complement our existing medication and also complement to psychotherapy, this has got to be something that we probably really dive into for the long run and not see it as just as simple, let's just do it for 6 weeks and see if it helps. I think exercise like this has to be seen as to be like a lifestyle. It's got to be something that you see like brushing your teeth. It's got to be something like, going to the dentist. It's got to be something that you really try to prioritize in your life to give you that, that positive outlook and to help assist your mental functions and in your mood states. So yeah, that would be my kind of take homes there on what we've sort of discussed so far.
I often look at it just like food. It's like you can have an unbelievably healthy meal of broccoli and lean chicken and that kind of thing. Well, that's great once, but you're only going to get the benefits of that if you eat like that for 3 to 6 months and longer. And the same goes for exercise.
Yep. Couple of little things here just to keep in front of the mind that, a couple of caveats here is that, the depression, so the evidence that we talked about here was mostly, if not exclusively, about depression and improvement in depressive symptoms and development of depression over time. Probably not as well known, exercises and resistance training on the effect of other type of mental health conditions such as anxiety, post-traumatic stress, and lots of other different subcategories there of mental health. So just important that we don't, once again, paint all mental health conditions with the same brush, but definitely a lot of these things we talked about today were geared towards depression. We still probably don't know the perfect prescribed dosages in terms of frequency, intensity, duration, and supervision models and progression models, but we do have a rough ballpark. And also too, we don't really know, I guess the pathophys behind it as well. So we're probably, is it because you're in a community of people who like to do yoga, or you've got a group of people that you like to run with or exercise with, or is there that true physiological change where it's something internally is happening to your brain and helping you out there? But look, it's if doing something is giving you a good mental health boost and over time is helping you with your depression, then it's helpful. And importantly today, we've put it up. We've basically put it up against papers that have looked at medication and psychotherapy compared to exercise. So this is definitely a strong exercise option. And I guess my sort of closing statement here is that, I think marrying it all up together is a really positive way forward for those struggling with their mental health, and specifically depression here. So yeah, that's today's podcast, and one that was really enjoyable to tackle.
Good on you, Mick. I know that it is close to your heart, and it's a great topic to discuss, and I'm glad that we have. And I think it's a really nice way to kind of round out this season. So thanks to you and your hard work.
Thank you
in making this all happen. And I'm looking forward to going around again with you when we get back, probably in about a month or so. But we'll see how we go.
Yeah. Mate, enjoy your time up. Make sure you keep active. We talked about Zone Zero a couple of weeks ago. So enjoy this break, but don't get too sedentary in your off season either.
Well, less time sitting at computers.
Mental health and physical health.
When we're normally
how good.
When we're normally podcasting, I might go walking.
Yeah, mate, enjoy that. All right, that's a wrap for season 2. That's it's a wrap. It's a big wrap. If you enjoyed this chat and the whole series, importantly, make sure to subscribe, leave a review, and share it with your mates. A quick disclaimer, as always, this podcast is for educational purposes only and is not medical or individual advice. Always seek guidance from a qualified health professional for your specific needs. A big thanks to our sponsors, Premax, high-performance skincare for high-performance people, and Learn.Physio, world-class education for health professionals. We'll catch you next season.